Hello, everyone. Thank you for joining today's Pathcare webinar. So sorry to keep you all waiting. Can anyone just give me an indication if you can see my screen and if you can hear me?
We can. Thank you so much, Carmen.
I can also hear, thank you.
I see Francina has your hand up. Or are you just indicating?
Hi, Carmen. I can also hear.
Let me just make sure. Okay, I think we can start. So my name is Carmen. I'm the product manager for genetics and fertility. Thank you so much, everyone, for joining this afternoon. This is a Pathcare webinar, well, general phlebotomy training webinar for all our phlebotomists doing TriScreen NIPT. I want to firstly thank you all for all your hard work with our NIPTs. Without you, we won't be able to get those blood samples in and do the testing for the patient. So let's get going. So we have a reproductive journey here at Next Biosciences. We offer a range of genetic testing services, but the one that you might know the best is the TriScreen non-invasive prenatal testing. So it's a safe screening test from 10 weeks of pregnancy. So when the mothers go for their first trimester screening test and it might come back as an intermediate or high-risk screening test, then the gynaes would opt for non-invasive prenatal testing to detect any chromosomal abnormalities in the fetus. So how does it work? It analyzes cell-free DNA from the mother's blood. So from 10 weeks of pregnancy, the placenta sheds some of the DNA into the mother's bloodstream, and we then detect this with next-generation sequencing. These are, as I said, the reasons for testing is if it's an intermediate or high-risk serum screen, ultrasound abnormalities, advanced maternal age, or a previous pregnancy was affected, or simply patient concern and anxiety. Most medical aids will cover the test as long as there is a valid reason, like intermediate or high risk. So just a quick overview of how it works. We receive the sample that you draw for us. We isolate the plasma, get the cell-free DNA that represents the fetus, and then it goes through our next generation sequencing method, and the results are sent directly to the referring healthcare provider. Okay, so this is our TriScreen test requisition form. You might be familiar with it. So the first section is what the referring HCP will fill in, and the bottom section is what the patient will fill in. So on the test form, it's just always good to check it quickly before you do the blood draw, just to make sure everything is filled out, especially the testing options. So you'll see there is a table at the top showing the testing options. We have TriScreen standard panel, TriScreen all chromosomes in the singleton test options, and then on the right we have our twin pregnancy option, which is only the TriScreen standard panel. So you'll see in the table at the bottom, we do have TriScreen add-ons, optional add-ons. We can do microdeletion testing, 22q only microdeletion testing, and rhesus, fetal rhesus testing. So for these optional add-ons, specifically for 22q microdeletion and rhesus testing, we please need 2 tubes of blood. I will also go through it again later, but just as a reminder, sometimes you might need 2 tubes of blood. If you ever need to do a blood draw and some of the add-ons are marked, feel free to give the number at the bottom of the test form a call just to notify us, and we can advise you and tell you how many bloods you need to draw. And simply you can just use 2 of the kits instead of 1. Just going through the list, please ensure that the gestational age is filled out. the days of the blood draw is filled out, the test indications, the healthcare provider has signed, the patient has signed, and then you can continue with the blood draw. If you have a scanner available in your depot, please scan and email the test form to triscreen@nextbio.co.za. This enables us to contact the medical aid even before the bloods have arrived at the lab, and then we are aware of the patient, so we can contact them and arrange any other payments necessary. Okay. So this is just everything that I said, important information to check, like patient signature. Then the T21 test requisition form. So this is like the NIPT, it's just a T21 only test. It uses exactly the same kit, it's exactly the same process, it's just a different test form. There's only one option on it, but everything else remains exactly the same. So if you get a test form like this, please just handle it like any other TriScreen blood draw. Okay. Please unmute if you have any questions throughout. I'm happy to answer them. Then going into depth in the TriScreen test options, as I mentioned, we do have some add-ons where an additional tube is needed. So you'll see for the Rhesus and the 22Q add-on testing options, we do require 2 strict tubes, either for the standard panel plus the 22Q and Rhesus, or all chromosomes or genome-wide plus Rhesus. You can, like I said, just give us a call or WhatsApp if you are unsure. Okay. Then this is what the collection kit looks like. Inside you have your strict tube, a biohazardous bag, an absorbent sheet, and a courier bag. If it does not have a courier bag, don't stress. When the courier comes, they will provide one for you. So this is just the protocol. I will also share the protocol with all attendees afterwards, but it's everything I just said. Make sure the test form is filled in. Once everything is filled in, please label the strict tube with 2 identifiers, so full name and date of birth. Unfortunately, we will need to reject the sample if it does not arrive with 2 unique identifiers, so we can match the blood to the test form. Then we need at least 8 moles of blood. If there is less than 7, we will need to reject it, as we cannot get enough of the fetal cell-free DNA to do the test. Okay. Then after doing the blood collection, you can just wrap it in the absorbent sheet, place it back into the Ziploc bag. Everything goes back into the box, the test form, the blood. You can contact us. Like I said, if you have a scanner, please scan the test form and email it to us. And then you can just ask for collection in the email. And the whole box with the blood goes inside the fridge until collection. Not the freezer, the fridge, please. Then this is just a summary. So just some things to remember. The gestational age needs to be 10 weeks. Unfortunately, 9 weeks and 6 days, we cannot accept that blood. It has to be 10 weeks of pregnancy. The strict tube also must not be expired. So there is some strict tubes at the depots that I know of that are expiring in October. Please always check the expiry date before doing the blood draw and request new kits if you need new kits. Just to let you know that the strict tube can be used up until day of expiry, so up until 12 o'clock that night. So if expiry is on 4 September, then you can use it 4 September until 12 o'clock tonight. Okay. Even if it gets to our lab in 2 days, as long as the blood was drawn on the date of expiry, we can still accept it. Okay. Then, like I said, label the tube. So we have a correct order of blood draw. So the strict tube should always follow the blood culture bottle or an EDTA tube. If it's not the first tube that you draw and the patient has multiple blood draws and you need to do a heparin tube or any other tubes, please just draw a EDTA wash tube before using the straight tube, as some of the additives inside the other tubes can affect the cell-free DNA blood, and then it might affect our results. Okay. Always try and use the median cubital vein. Make sure the cleaning alcohol is completely dry. Please do not use any butterfly needles or syringes, as it's too small and it will lyse the blood when it goes into the tube, and then we can't split the maternal and the fetal DNA from each other. Make sure to release the tourniquet before 2 minutes, and please, like I said, draw at least 8 ml of blood. If you cannot get enough blood with the one vacuum, you are welcome to use an additional kit to draw another tube and just send us both, and we will then put them together to get enough blood. Please do not shake, just gently invert it after collection and put it into the fridge until we come and collect. So like I said, there's an order of blood draw. So either after the blood culture tube, or if it's done anywhere else in our little diagram here, you can just draw an EDTA wash tube before using the straight tube. Okay. Then how to prevent hemolysis. I'm sure you all know this, so I'm just quickly going to run through it. So do's: warm up the venipuncture site. Make sure that the cleaning alcohol is completely dry. Use the median cubital vein. Use a 21 or 22 gauge sampling needle. Invert 8 to 10 times. And please don't leave the tourniquet in place or use any fragile or bruised veins. Don't use a butterfly needle. Don't apply additional pressure. Please don't freeze or shake the tube. And don't forget to let us know, because we have 5 days to get the sample to the lab for it to be accepted. If the transit time is outside 5 days, we will need to reject the sample and get a redraw. Okay, so just some important points that you might have seen in the emailer that went out is the test form needs to be completed. We need accurate labeling. We need to ensure the tube is not expired. The gestational age is above 10 weeks, and we need enough blood. Okay. And like I said, additional tubes might be needed for certain options. If you're unsure, don't hesitate to give us a call. Someone can assist you. Okay. This is just a reminder and how to contact us. So you can either WhatsApp us, you can phone us, or you can email us, whatever is the easiest for you. Once collection has been arranged, the team will respond to your email advising you on the collection arrangement and attach a copy of the waybill. Okay. If you are low on kits or you see your kits are close to expiry, you can also order new stock from us using the same method, same email, same number, whatever works for you. Thank you. Is there any questions?
Sorry, can you go back to the next slide?
I cannot hear you. Give me one
The
second.
latest slide, the one that has email and contact numbers.
This one.
Yes, thank you.
Perfect. Any other questions? Perfect. I will share the webinar recording with you, and you are welcome to share it with any of your teams. And then thank you again so much for assisting Next Biosciences with our phlebotomy and helping the patients with access to care to NIPT, and enjoy your afternoon.
Just make sure.
Thank you very much.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye.